Infertility affects millions of people worldwide. That's why some are looking to science for reproductive options. We sit down with Dr. Carolina Sweldo, board-certified specialist of reproductive endocrinology and fertility at Clovis Community, to talk about the importance of having a reproductive plan and learn more about egg freezing and aging ovaries.
When you talk about egg freezing, you're really talking about it as an insurance policy. So it's something that you hope to never need, but you want to have just in case.
Women are born with all the eggs they will have in their lifetime and lose those eggs every month with age.
After age 35, we begin to see a very real decline in the number of eggs that we're working with and the quality of the eggs that we're working with.
Egg freezing is one way to combat the ovarian aging process.
The concept is that in the ovary, there is a pool of recruits, if you will. And from that pool of recruits, one egg is selected out to be the dominant follicle. That's the one that goes on to ovulate. And if there's no pregnancy, then that goes away. And the next month, a whole new group of recruits comes back for the next attempt. The idea behind egg freezing is not to use up your eggs faster, but rather to recruit or to stimulate those eggs that we otherwise would have lost during that month or during that menstrual cycle.
Egg retrieval is non-invasive and usually done before age 35 when a woman's eggs are younger and more likely to produce a healthy baby.
Is we stimulate the ovaries to recruit those eggs. So we give extra hormone of what your body makes normally to generate that growth. So instead of producing one egg for that month, hopefully you're producing many. And then at the end, we do the procedure for egg extraction, which we call egg retrieval or oocyte aspiration. So at the time of egg retrieval, that's done transvaginally. We aspirate or we take out as many eggs as we can. That's handed off to the lab. The lab will identify how many total eggs we were able to retrieve, and then the number of mature eggs, so the good ones, so to speak, that will then go on to be frozen for future use.
This family planning option allows patients the ability to choose when the time is right to conceive.
So those eggs would have to be unfrozen, they would have to be fertilized with a sperm source, whether that's a partner or donor. Embryos need to be created in the IVF laboratory and then transferred back into a uterus, whether that's your uterus or a gestational carrier.
Overall, Dr. Sweldo says it's important to research if egg freezing is right for you.
You can do what's called ovarian reserve testing to understand the quantity of eggs that you currently have present, and then combine that with a visit with a fertility specialist to talk about what this may mean for you and whether egg freezing would be a good option. I really think the message is about knowledge, understanding your body, understanding the concepts of what ovarian aging is, what does my menstrual cycle normal, what's not, and really looking towards what are my options, how can I empower myself.